Welcome back, everybody. I've been told shopping for skincare can quickly become overwhelming. I've done a little shopping for some skincare products. I have, especially if you don't know what you're looking for.
Right. So if you want to keep your skin healthy, our next guest says you got to start with the right products. We have local dermatologist here, Dr. Sherry Ingraham, with tips and tricks for every age group you have for us, which is really lucky because your skin's ever changing, right?
Absolutely. So when you're in your teens, we've all talked about acne, right? Either you've had it or your children have it. So what do you need to focus on in your teens is oiliness and prevention of blackheads, whiteheads, and scarring papules. Neutrogena has fabulous over-the-counter products. You can buy these at the grocery store. There's great products for acne, body acne. But remember, when you're a greasy teenager, you don't want to overstrip the skin. That's something I talk to patients about a lot. One of my favorite tricks are these little Neutrogena acne pads. You can cover up any spot on your face with them. You can wear them to work. My staff literally wear these around clinic.
Put one on
You can
me.
walk around. I can kind of see it on you, but from afar, I mean, literally, it blends in. You can sleep with it on. My kids sleep with them on.
Yeah.
It helps heal the spot. So instead of you picking it, nothing's ever been healed by picking, I tell patients.
I love picking. I need to not ever do it.
But this prevents scarring, and our job is to prevent scarring. The other thing I think that's a misconception is that we need to wash and wash and wash, and that tends to strip the skin. So I like products with ceramides. CeraVe makes great ceramides, and you want ceramides. That's the glue that holds our cells together. And studies have shown the more ceramides you put on the skin, the less acne you have, your barriers protected, your rosacea, eczema, psoriasis don't flare up as much.
Okay, so we're learning about ceramides right here. They help maintain the skin's firmness. They minimize your fine lines. I think everyone is after that after a certain age, and they can also help with your dry skin, which is really nice.
Absolutely.
I think I did that thing when I was a teen that I was stripping my face because I knew I was oily, and it was just making me more and more oily.
Right, it's a vicious cycle. So what you want to do is you can use these aggressive products, but use a good barrier cream. So you find something with ceramides in it or hyaluronic acid, which kind of brings us into our 20s. So what's happening in our 20s?
That's what I thought we used, something that was so strong that was almost like an alcohol base.
Yes, and that's kind of that Seabreeze old school strip your skin.
Yeah, I mean, yeah, it was like putting like lighter fluid on your face.
Too aggressive. So you want to be gentle but firm, like you are with your children, right?
Yes.
Okay.
And London's going to need, I mean, when she's a teenager, you're going to have to tell her all this.
Exactly.
Right.
You can take some now. Take some
You're gonna
now.
need this.
And this is off the
what age?
grocery store
Put it in
shelf.
your pocket.
Now, in your 20s, you want to think about prevention, okay? So you want to think about in our 20s, our skin is changing. You want to use products that really prevent fine lines and wrinkles, prevent sun damage, maintain that barrier. I love vitamin C. It is the holy grail. Start to introduce that into your regimen in your 20s.
Don't drink it, Rod.
You can eat it, but it will get to your skin faster if you apply
Listen
it
to the
topically.
doctor.
So ideally what you want to do is, my children, I chase them around, they're 12 and 13, and every single morning I make them put this on
Put it on,
their
Rod.
face. Okay.
Bring it on, Doc.
Every morning, a thin layer, and I get my men to do this too. Put that on your face. Put that on your scalp.
Put this on my scalp?
I put it
Like-
on my hands
Yeah, on your
every day.
forehead.
Sure.
Do it.
It's potent vitamin C. There are over-the-counter brands. SkinCeutical makes a wonderful potent vitamin C.
Is it a close-up of my bald head?
How does it feel?
It prevents wrinkles, fine lines, brown spots, but also you want to get hyaluronic acid in there too. Neutrogena makes great hyaluronic acid products. La Roche makes great hyaluronic acid. So you're maintaining that skin barrier. It's all about maintaining the barrier as you age.
But that was a really tiny amount that you put on me.
Yeah,
is that
it
what,
went
is that
a long way.
Is that what we're using? Just
A
that
little
small
bit,
amount?
Yep, it's liquid gold. I say don't spill
This
it.
thing's gonna last forever.
It'll last you about 6 months if you're using it every day, but put it on your face, your neck, and your chest. Now we're getting into our 30s and 40s.
Yes,
this is the
our
action,
area. This is our
action
area.
group. So everyone in their 30s should theoretically already be on a vitamin C product, already be on sunscreen, and the Holy Trinity is adding a retinoid. So there's prescription tretinoin you can get from your dermatologist for the treatment of acne, but can also be prescribed for wrinkles, or you can go over the counter and get a retinol product, which is great. Neutrogena makes them, Rock makes them. I also like to talk about glycation. And the glycation story is in your 20s, glycation starts to happen. All the sugar in our diet and glycation in products that are in foods to make them taste better bind to collagen. They make collagen crunchy, so we start getting crepey. So the new science...
Don't want that.
Don't eat your crepes because it makes crepey skin.
Oh, okay. Crepey skin.
So the new science is block glycation. So there's anti-glycation products like AGE interrupters, the new science from SkinCeuticals. I tell my patients, put that on morning and night, and you'll not only block glycation, but you can lighten up some dark spots too.
Which I have. And I was under the assumption, hey, I'm in my 30s, I'm not gonna have acne anymore. That was a lie. So I definitely need to incorporate more of these things. This retinol, I was at dinner with a friend last night, and I said, hey, I have some texture going on. She's passionate about skincare. She says, what retinol are you using? And is it really expensive? Neutrogena doesn't seem like
Neutrogena is a very well-priced over-the-counter brand, and they actually have this new stronger strength that I like a lot. This is the intro product. You can bump yourself off to the 0.5, and then if you need to, you can bump yourself up to a prescription.
Okay.
All right, bring on the old man stuff.
Yeah,
So the
come
old
on,
man
get over here.
stuff,
Switch your room.
The 50s.
Look at her pushing me over. Get over there.
50s, you're
Tell
talking
him.
about barrier. So you want cleansers. I love these oil-based cleansers. They don't strip the skin. They'll take your makeup off, but they won't strip your skin. But also you want to look for products that have different ingredients. You're looking for cholesterol. So triple lipid from SkinCeuticals, cholesterol rich. I love these new products from Sante because one of the most common complaints I get in people in their 50s is I have brown spots and I have this rosacea-like redness. And so there's new products that are developed for skin that is in that age group that help limit the redness in the skin. Heparin sulfate in these products is combined with retinol to really get the improvements but reduce some of the irritation and redness. And then a really exciting new development, a whole new genre of skincare, a paradigm shift, is this micro droplet injectable HA Skin Vive, which just came out.
Say that fast 3 times.
That's the one you put in your coat.
So this is the newest technology, just got FDA approval. What it is, it's micro droplet HA that you inject into the very superficial layer of the skin. It gives a 6-month glow. So instead of applying HA on top of the skin, you're just applying it to the outer layers of the skin, which improves the texture and the moisture. And studies have shown it gives you smoothness, a really nice smooth texture, and you can even use it off-label in the next.
Okay, all of this being said, we are still using our sunscreen. I heard a rumor that you say a shot glass. We want to take shots? A shot glass a day. Sunscreen.
Exactly, for your whole body.
Yeah, I don't come in on drinking day. I come in on
we tried to
sunscreen.
find beer. There was none available. I drank it all on Friday.
Listen, Doc's skin is rocking, okay? Let me tell you up close, it's ridiculous how awesome your skin is. So I believe what you're saying.
Right, we want it. We want it. And so reminder of the sunscreen. For more information or to connect with Dr. Ingraham, visit the Scene on Houston Life section of our website.